Hi guys, in today's video we'll be discussing the clinical triad which is used in diagnosis of hip impingement. It's also termed as femoroacetabular impingement. The pain which is seen while performing a squat or a deadlift, especially in the end ranges, can commonly be hip impingement. So hip impingement is basically defined as a motion related disorder of the hip. So there is an improper contact between your hip bone and in between the acetabulum which leads to hip impingement. So what is the clinical triad? Let's see. The first one is the symptoms which is experienced by the patient or the client. The second, clinical signs which are based on the diagnosis of the physiotherapist or your consulting orthopedician. And the third one is based on the radiological findings based on X-ray or your MRI. So these are the symptoms that you need to look out for in case you have hip impingement. The pain is usually seen in the hip, your lower back, in the groin region, and also can refer to the anterior thigh. So the symptoms can also be shown as a clicking, popping, or a catch sign in the hip, especially while performing a squat or a deadlift in the available deeper ranges of the motion. So now let's see the clinical signs. These are the tests which are performed by the physiotherapist. The two commonly used tests, which is flexion, abduction and internal rotation test, and flexion, abduction and external rotation test. So these two tests usually tells us if there's a sign of hip impingement or not. So before an early sign of hip impingement can also be an active loss of hip internal rotation ranges as well. The last aspect of the triad is the imaging findings. The commonly used imaging findings can be an MRI or an X-ray. So it is very important to have a confirmatory diagnosis of hip impingement. So the commonly seen morphologies are a cam morphology, which is a dysfunction in the femoral head, a pincer morphology, which can be a dysfunction in the acetabulum, and can be a combination of two, which is termed as mixed morphology. So to conclude, a combination of all these factors are required to have a confirmatory diagnosis about hip impingement. So there are multiple studies which shows that the athletes or the clients had signs of impingement in their radiological findings, but the clinical signs and symptoms were not present. And also to start off with rehabilitation, we do not have to wait for a radiological finding. Based on the clinical signs and symptoms, the rehabilitation has to begin. So please stay tuned for more updates from Invictus Performance Lab. Signing off, Abhishek Nayak.